Vertical facial development and sleep apnea. Most people are surprised when any suggestion made that their face is slightly longer than ideal. However, understanding the concept of craniofacial dystrophy is vital for anyone who wants to know the answers to why they have problems. And from that, you should be able to draw the best solutions, since in medicine, any form of therapy should be aimed at the cause and aim to create a cure. People who suffer from jaw joint problems, temporomandibular dysfunction as it is often caused, have compensated for a reduction in their airway and their tongue space by holding their head slightly forward and the tongue between the teeth. Usually these patients, the tongue placed between the side teeth. And by placing the tongue between the side teeth, there are two problems. One problem is it's not in the roof of the mouth, so it's not going to act as a natural antagonist to the jaw closing muscles. And the other problem is by being between the side teeth, it prevents the teeth coming completely into contact. These people normally sit with their front teeth some 4 to 5 millimeters away from touching in a full biting position. And consequently, the jaw joint reforms so that the position they rest in, where they are most of the time, is the normal position. Now, the problem with that is that then when they do bite together, they're biting in a position that's then not normal, and the jaw joint isn't balanced to accept loading in this position, leading to often just subacute, but often quite acute problems, and which are normally precipitated during bouts of stress and strain. So jaw joint problems tend to go in a wave, coming in bouts, often lasting 3-4 months or more. And once you start biting together without the antagonistic relationship with the tongue and the roof of the mouth, there's nothing to stop this grinding or jaw clenching, just going on and on and on and on, a little like an old steam engine with a governor that's been removed, according to really quite serious and severe problems in these individuals from a very, very simple issue. It can be corrected very simply for a short period of time using a splint, which of course will change the biting position by effectively lowering the biting position of the teeth. These results tend to be very stable for a short period of time, and I worry that it's not really treating fully the underlying problems, which is really the posture and the tongue space.